We are on location today for a very good reason for our Women's Care Wednesday segments. And I'm joined by two of the fabulous doctors here at Women's Care Florida, the Largo location. And the reason we're out here today and not in the studio is we're talking about some of the surgical procedures that you can have while in office. I don't know about you, but that already sounds a lot easier to me instead of having to go to an intimidating hospital. So to kick us off, I do want to ask, this is a unique thing that your office provides, correct?
Yes.
And so being able to provide this, maybe you're at home thinking, what procedures do they offer that they're able to take care of right in the office?
Oh, we offer DNC procedures. We can take care of heavy bleeding, periods, abnormal pap smear procedures, basically anything that requires some pain control and some relaxation, but isn't necessary to go to the hospital for.
And I was going to say, going to the hospital, there's so many things that kind of can be intimidating when it comes to that. So being able to have it done right here in the office, what do the patients say? That's going to be a lot nicer because I already love this atmosphere.
Well, there's a lot of benefits to do it in the office. The main benefit is being able to do it in the office with the doctors and nurses that you know. And also, as opposed to doing it in the hospital, we do it in our office, which negates the need for a hospital fee. So it's actually less expensive for patients to do the in-office surgeries.
Hey, I hate talking about that, but we do have to talk about costs when it comes to medical. That's definitely a benefit. And you mentioned being able to have the doctors and the nurses that you're already familiar with. Now, one of the things, though, I think about with surgical procedures, of course, I think of the anesthetic, what you're able to use to be able to keep people sleeping, comfortable, whatever the surgical procedure may need. You're still able to do that?
Absolutely. So our priority is our comfort and safety. So when you have the procedure in the office, our main goal is to keep you 100% comfortable, which means you'll be sedated, you'll be asleep if that's your preference. You won't feel any pain or any discomfort. After the procedure, we usually watch for about 30 minutes and then people are good to go home.
They're able to move on. And again, you listed already the procedures. Let's talk about leading up to that, though. What can people expect that may be different if they've had to have procedures in a hospital setting before?
Basically, they just come in as if they're coming for a regular visit.
Yeah.
They'll need to have somebody drive them, so they'll have a family member or a close friend with them. Once they're here, we check them in. We bring them back to one of these rooms. They'll meet with the anesthesiologist. They'll go through their history with them. We'll rehash what procedure they're having. We'll start the IV. At that point, that's pretty much it. Once they have the IV, we'll give some pain medication, some medication to relax you, and then the procedure takes place.
I'm curious, what's the feedback that you get from patients? I'm assuming that patients really do appreciate this once the procedure is done.
Well, they do appreciate being able to come to an office setting and have a sedation procedure where they have no discomfort. They go home within hours of arriving, and they're back to their usual activities within 24 hours.
And we touched on it at the beginning. This is unique. Not all offices offer that. So one thing that's special here in Largo. And again, 6 doctors, 2 of them right here, smiling, kind. So much to be said about Women's Care Florida. And when you do walk into an office, it's definitely a calming. That's going to be nice as doctors to be able to work in a place that has this kind of environment, right?
Oh, absolutely. It's where we're used to going. It's where we come every day. So it's nice for us to have our patients here. It's nice for our patients to be here. Familiar surroundings. They know the nurses. They know us. So it flows nicely.
It's a win-win, and I'm assuming at the bottom line, you're able to treat things. If you guys are relaxed, the patients are relaxed, you're able to get the outcomes that people desire when they're having these procedures, right?
Sure, absolutely.
Good stuff. Well, ladies, thank you so much. It's so nice to meet both of you today. We love being able to come out and take our Women's Care Wednesday segments on the road, of course, and thank you to the both of you. As always, you can get more information on their website or even our website at tbmorningblend.com.
Thank you.
Thanks.